legislature.
Thanks for watching TMA's Legislative News Hotline for Friday, June 5th. I'm Brent Anir. The Texas Senate and House of Representatives each gavelled the 84th legislative session closed, sine die, on Monday. Now the fate of the bills that passed is in the hands of Governor Greg Abbott. He has 20 days after final adjournment to act on bills that were sent to him during the end of the session. He can sign the bill into law, he can simply allow it to become law, or he can veto it. On the last day of the session, we asked Darren Whitehurst, TMA's Vice President of Advocacy, the quarterback of TMA's legislative team, to join us here in the studio for a comprehensive wrap-up of all of the bills of interest to medicine. It's quite a list. I'm here with Darren Whitehurst, quarterback of the team, leading us through the legislative session, here to talk about the 1,200 or so bills that your team tracked. And I guess you want to go worst to first, which means we're going to begin with those that we hoped for, that we weren't successful getting across the finish line.
That's right, Brent. Again, is that when I say worst to first, again, is I like to start with the shortest first and go to the list at the end, which has a lot of positive things. But as far as things that didn't pass that we would have liked to have passed, I think I'd put at the top of the list the texting while driving ban. Is that we're successful in getting it through the House. Ultimately came up a vote short in the Senate. So, there's always next session. We've been fighting that battle at least for 3 sessions. Going to fight it again. Also, sort of on that same avenue would be a pilot program for needle exchange. Certainly, there are public health reasons why the state would want to look at developing a needle exchange program, but again, we're unsuccessful in doing that. One other bill, interstate compact. A lot of talk about that. Have heard some very sundry things from physicians, both positive and negative, about the interstate compact. I think the concerns that we have are what happens if the state fails to do it, and we didn't do it. A lot of talk about at the national level about a national licensure for telemedicine services, and certainly we have concerns about what that would portend for the state, and again, about a West Virginia doctor that is practicing in Texas or any other state that's practicing in Texas that really has no accountability to the rules and regulations in the state of Texas. And then a couple of smaller bills that impacted some of our specialties we're pushing forward, like dispensing of certain topical products, and the final one would be relating to telemedicine services. We were pushing a bill that would have required the insurance companies to pay physicians in local areas basically the same thing that the telemedical doctors were being paid, and we're unsuccessful on that.
Would have leveled the playing field.
That's exactly
fairness.
Right. That's exactly right.
So then are we ready to shift gears?
Well, just a little bit. So also on sort of the negative side, bills that passed that that either that didn't have language that we wanted in it, or that I've heard doctors express some concerns about. First of all, with the budget.
Right.
There were certain things that didn't happen in the budget. Probably the chief amongst them was the parity rate increase for primary care docs. Certainly spent a lot of time and effort trying to get that across the finish line. At the end of the day, we're unsuccessful and are very disappointed in the legislature because ultimately, what we have been pushing for, what TMA has been advocating for, is trying to provide access for individuals in the Medicaid system, and think that this will certainly hurt access. There was also supposedly some money for women's health services for primary care, about $20 million, and that didn't make it into the final version either. There were some pieces of legislation that passed that, again, have heard some concerns from doctors. Right to try would be chief amongst them. There is currently a process at the federal level that allows for right to try through the FDA process, would set up a similar process to that in Texas. Also, artificial food and hydration at end of life. Again, we think that the impact of that will be very small because there are very few people that are going through the current system at end of life relating to hospital rules and regulations for where the patient's family differs with what the physician wants to do. There was language relating to Down syndrome, that a requirement that doctors would have to hand out state mandated materials. That ended up passing, and certainly we want to make sure that patients are educated when they receive a diagnosis that their child is positive for the Down syndrome gene. We've got concerns about the accuracy of the material and the ability of the state to keep that information updated. We did include protections for physicians, so are hopeful that the impact of that will be minimized. And then finally, cannabis oil. I've heard from both groups of doctors, some supporting it, some not supporting it. I think that obviously in looking at the materials, probably more research is needed to be done. I think at the end of the day, the legislature responded to individual families that were testifying about the needs of their children. And again, is that I think the language that was adopted, very tightly controlled on who can prescribe it, basically is limited to pediatric neurologists. So a very small universe of doctors that will be prescribing this medicine. And so not really sure what the impact is going to be, but going to be keeping close tabs on what happens on that arena.
That was very emotional for them to hear those families.
That's right. So moving on to the positive aspects is that, and I'll start with the dead, what I call dead and we like it. I think that first and foremost is the EKG bill would have required student athletes to get an EKG. It was a mandate, started off as a mandate. The bill at the end of the day was not a mandate, provided some protections for physicians that were providing the service. At the end of the day was not legislation that we support, that we felt like we could support. The pediatricians and cardiologists were basically saying that there's not the clinical evidence to support it. That bill did not pass. Also, there was legislation related to raw milk. TMA testified on the bill, but certainly the pediatricians testified against it and had concerns about the transportation. And I think that that's really what got that bill hung up at the end of the day, was relating to transportation and ensuring, raw milk is not safe to begin with, because I guess you're more susceptible to certain diseases. But the legislature ultimately was concerned about how it would be transported and how it would be sold, and ensuring that
Logistics.
It was kept as safe as possible. We also had legislation that would have restricted the ability of pediatricians to talk to their patients about firearms in the home. That legislation did not pass. There was legislation giving physical therapists the ability to directly access patients without going through a physician's or getting a physician referral. That legislation did not pass. There was one that would have allowed marriage and family counselors to use the DSM guide and basically to diagnose. And we don't want to restrict marriage and family counselors from being paid, but also don't think that they should be diagnosing.
Diagnosis is part of the practice of medicine.
That's exactly right. We also had several bills that were pushed by I won't even call them telemedicine companies, by companies that wanted to basically be able to prescribe over the phone, not establish a patient-physician relationship. We have been fighting against that for several sessions, and the medical board has been very involved, and I think they've talked about it some in the past, but we're able to thwart the efforts of those telemedicine companies that wanted to eviscerate the patient-physician relationship and basically be able to prescribe whatever medication without ever having developed a patient-physician relationship.
There again, not the good practice of medicine.
That's right. And then finally, there were a couple of bills at the medical board, some that we did a lot of work on, and actually we're going to see the medical board next sunset, so this issue is not going away, but making sure that the board is treating physicians fairly, without at the same time ensuring a high level of quality care and not eliminating their ability to get rid of bad physicians, because there are bad physicians. And so again, the medical board did not change. There were not any legislation passed relating to the medical board. But we're obviously going to be working on that issue next session to make sure that physicians that are under accusation by the board, that they're appropriately protected.
This session's not over, and you're already looking ahead to next session.
That's exactly right. Well, I talked to my text pack director, and he's talking about campaigns already. So it's a never-ending process. Finally, on the positive notes, we'll, again, have a long list, and I think that actually the Communications Division is going to be putting out sort of a matrix of all of the issues that we dealt with during this legislative session, but want to highlight just a couple of issues. And we'll start with the budget, since that's the most important thing. Although we didn't get rate increases for on the Medicaid side, we did see progress on a number of fronts, starting with graduate medical education. The state made a significant investment of, close to $60 million. It's actually about $53 million. The Senate proposal had 60, so they used 53. The other $7 million were used to improve the family medicine residency programs and also to restart the preceptorship program, both of which, we are very supportive of. There were also increases. There was an increase of about $50 million in women's health services, about $80 million in mental health services, and then $20 million for surveillance for Ebola and other infectious diseases, and then finally about $11 million for tobacco cessation. So I think on the whole, if you take out the rate increase side, medicine did very well in the budget. And I think that's a testament to the work that physicians did. Beyond that, certainly one of the priorities of the legislative session was to do tax cuts, and saw some tax cuts that will certainly be beneficial to physicians. Probably first and foremost is that the legislature eliminated the occupations tax. And whether or not doctors know it or not, is that they're paying $200 a year in occupation tax for the privilege of practicing in the state of Texas. That was eliminated. So I think that is a very good thing. They also lowered the margins tax, so physicians should see some benefit on that. And then finally, as homeowners, they're going to see some benefit as that, because the legislature made changes in both those
property
provisions.
Tax.
That's right.
Yeah.
We also moved the drug monitoring system out of the Department of Public Safety and moved it over to the Pharmacy Board. We eliminated the controlled substances registration process that physicians have to go through. Again, I think that will be both a small financial benefit to the physicians, but also eliminating the hoops that they were having to jump through at DPS. And again, ultimately, the physician that can't prescribe is basically like trying to do something without one of your limbs.
Because we heard stories of them losing hospital privileges temporarily and that sort of thing.
That's right. So we're very happy about that. On the insurance side, a lot of talk about out-of-network billing practices. Currently, as most of the physicians know, the hospital-based physicians that are practicing at an in-network facility, if they're out-of-network, the patient has the ability to go through a mediation process if the claim reaches $1,000. There was a push this session to lower that to zero, and basically every patient that was out of network would have been able to go through that process. So doctors could have been required to go through a mediation process at $10 or $25. It lowered the threshold from 1,000 to 500. Thought that was a fair amount. The legislature agreed and ultimately passed that legislation. We also had on the Medicaid HMO front a bill that passed part of our Healthy Vision 2020 that required greater accountability for these Medicaid HMOs, both on the network adequacy side and then ultimately the potential of suspending their ability to enroll new people into the Medicaid system until they got their network in order. Had a bill on e-cigarettes to limit their sale to minors that felt very positive about. On the immunization record side, required MTRAC to keep records. They were destroying records when the child turned 18 if they didn't opt into the system proactively. This basically moves it up to the age of 26 so that no 18-year-old is really thinking about, I want to keep my immunization records or I don't. But when they end up going to college or going to the military or going somewhere else, they'll find out that they need their immunization records. And so this will keep it until they turn the age of 26 and allow them to access that information. We also had legislation on insurance cards relating to plans that are sold under the Affordable Care Act. The qualified health plans would require the notification to the physician and their practices on the card that says that person participates in a qualified health plan. That will enable the doctor to provide better education to those patients, because those patients are unique in the insurance world, because that qualified health plan allows for a 90-day grace period where the patient doesn't have to pay their pay their premium for 90 days. And this will allow the doctor to say, you need to pay your premium. Because what we're finding to some extent is that these patients don't pay their premium, they lose their coverage. They lose their coverage for an entire year. And if the doctor provides services during those 90 days, they can have their payments recouped by the insurance company. So it's a bad deal all around, both for the patient and the physician, if the patient doesn't pay their premiums, there are bad things that can happen.
And so with this, there can be some education to prevent all that bad stuff from happening.
That's exactly right. And then finally, there was a lot of work done on sunset relating to healthcare agencies. And at the end of the day, legislation passed relating to both the Health and Human Services Commission and to the Department of State Health Services, which are the principal agencies that we deal with on healthcare issues that impact programs like Medicaid and all the public health programs in the state. You know, at the end of the day, those vehicles were bills were vehicles for bad legislation, and at the end of the day, the bad legislation wasn't included in either pieces of those legislation. And so I would consider that to be a huge victory. I think that we've got better processes at both the Health and Human Services Commission as it relates to Medicaid in particular, but also the Department of State Health Services as it relates to public health programs. So, and I could go through the list. The list goes on and on. I think it has been a very good legislative session. You know, and it is not the success of the lobby team. Is that the success is far beyond the lobby team. A lot of people here at TMA that contributed time and effort on the policy side, on the legal side, on the communication side, and really want to express my appreciation to them for the work that they did. But most of all, to the doctors who came to First Tuesdays, to the Alliance members who came to First Tuesday, to the county medical societies. Whenever we needed help, we could always call and get help. And so really do want to express my appreciation to the whole team, because it takes a village to get this legislative program that we have. There is not a single association that does as much work in the legislature as the Texas Medical Association. So, and
I know you've heard time and again from legislators about the influence of having physicians come and testify, come to visit them, to get to know them. It's immeasurable, right?
That's right. That's right. So again, my hat's off to the physicians that took time away from their practice to come down here for First Tuesdays, to the Alliance members who did the same, to the doctors who testified. Again, it's beyond words, my expression of gratitude.
So that's it. Sine die, and you're already talking about
next session.
2 years from now.
That's right. Again, is that the political process waits for no man, and we're already talking about campaigns. Certainly, TexPAC is getting ready to gear up. We already know that we've got a number of friends that are under attack that are going to get challengers, and it's up to medicine and other groups that are looking for good people to be out there helping them get reelected.
So you might end with a rallying cry, or?
Well, I hope that everybody that's listening to this message contributes to TexPAC. If they don't, I would encourage them to do so. Again, we can't be successful if we don't have members over there that are open to listening to our message. And again, it's the personal relationships that doctors have with their legislators that get them elected. But TexPAC is a critical piece of helping actually get them elected. So if you don't contribute, please consider doing so. If you do, you might give a little bit more. But again, I really do appreciate all the support that I've had this session.
Fantastic. Well, congratulations.
Well, thank you very much, Brent.
So as we mentioned, many bills await Governor Abbott's decision. Since our Monday taping, he vetoed 2 TMA-backed bills, Senate Bill 359 and House Bill 255. 359 would have permitted physicians to initiate a 4-hour hold on a patient he or she believed was a danger to self or others. In this situation, the patient would have voluntarily sought emergency care, but then would have wanted to leave. And House Bill 225 would have shielded from prosecution anyone seeking emergency medical help for someone who overdosed on drugs. Physicians providing care or prescribing anti-opioids would have been protected as well, but both bills were vetoed. TMA hopes the rest of the bills to improve patient care and help doctors provide that care will fare better. That's all for now. I'm Brent Anir with TMA. Thank you for watching TMA's Legislative News Hotline.